My name is Dr. Patrick McGahan, and this is a presentation on platelet-rich plasma injections, also known as PRP. In this video, there will be a demonstration of a blood draw. I'm a board-certified orthopedic surgeon that practices in San Francisco, California. I specialize in arthroscopic surgery of the knee and shoulder. I also use biologics such as PRP to augment healing and recovery. In this video, we will have a brief introduction of PRP, how it is made, the orthopedic uses of PRP, the evidence in the orthopedic literature, various risks and alternatives, and a case example of the use of PRP for lateral epicondylitis. Blood is made of 4 components: red blood cells, white blood cells, platelets, and plasma. Platelets have growth factors that can be used to induce natural healing. PRP is made from blood drawn from the patient and placed in a sterile container. It is then placed in a centrifuge for 5 minutes where the blood is spun at high speeds to separate the platelets from the rest of the blood. The desired product is then drawn up in a sterile syringe and injected at the site of injury. This is an example of the blood draw to harvest platelet-rich plasma. This is done in our office and takes less than 2 minutes. As you can see, a nurse will draw the blood, and then I draw the blood into the sterile PRP syringe. Approximately 15 cc's of blood are removed. Patients do not feel any effects from this small amount of blood being removed. Following the blood draw, the syringe is then placed in a centrifuge. The PRP is in the centrifuge for approximately 5 minutes. Sometimes a second cycle is needed to further centrifuge the blood products. This can all be done in our office, and the whole process takes approximately 15 to 20 minutes. Following the centrifuge, I then separate the PRP from the blood. The PRP is this golden fluid which has all the blood products removed. This is the finished product. Drawing 15 cc's of blood typically yields 5 cc's of PRP for injection. This PRP can then be injected at one site, or it can be separated, and 2 cc's can be injected at one site, and an additional 2 cc's can be injected at another site, depending on the condition being treated. Platelet-rich plasma is often used in orthopedic surgery and sports medicine. It is often used in soft tissue injuries. It can be used in the post-surgical setting to augment healing. It can be used in tendinitis, such as lateral epicondylitis and Achilles tendinitis. It can be used in tendon tears, such as rotator cuff tears or slap tears of the shoulder. It can be used in ligament tears, such as ACL tears and PCL tears. It can be used in arthritis, such as knee arthritis, and for fasciitis, as in the case of plantar fasciitis. There are multiple orthopedic studies that suggest that PRP works. There is evidence that pain and function recover faster. Studies suggest that PRP is effective for partial tears, tendinitis, as well as sprains. It can help to lower surgical re-tear rates. Surgical grafts, such as ACL grafts, will mature faster in the setting of PRP, and return to play is often improved. Some of the strongest evidence for the use of PRP comes for joint arthritis, especially knee arthritis, where it has better outcomes than viscosupplementation or cortisone injections. The overall risk of PRP is low. There is a less than 5% of risk, which includes infections and injection site pain. However, in my practice, I have not experienced these complications. Here's a clinical example of the use of PRP for lateral epicondylitis, also known as tennis elbows. This is one of the most common applications of PRP. However, it should be noted that the example used here is analogous to the use of PRP in various conditions such as Achilles tendinitis, partial thickness rotator cuff tears, slap tears, and knee arthritis. The harvesting and the injection, as well as the postoperative protocols, are similar for all these conditions. Lateral epicondylitis is a condition that affects the outside of the elbow. It is commonly referred to as tennis elbow. However, most patients with this condition do not suffer it from playing tennis. The most commonly injured tendon in lateral epicondylitis is the extensor carpi radialis brevis, also known as the ECRB. ECRB stabilizes the wrist and helps to extend the wrist. This is a common condition in men and women over the age of 40. It's typically an overuse injury, which can occur with racket sports such as tennis, but also with repetitive movements such as weightlifting and typing. This typically results in the insidious gradual onset. Pain is over the lateral and posterior forearm, and it worsens with activity and improves with rest. Initial management of lateral epicondylitis, like most tendinitis, is conservative. This involves rest, activity modification, and physical therapy. However, if the pain persists, then PRP is a good option. This is clinical footage. I first use an ultrasound machine to locate the area of pain as well as the area of interest. This is showing the radiocapitellar joint with the common extensor tendon inserting onto the lateral epicondyle. You can see irregularities within the tendon indicating pathology. After the blood has been drawn, I then localize the area of pathology with the ultrasound and I inject the PRP. This is a frozen image of the ultrasound showing the area of interest. The radiocapitellar joint, the common extensor tendon, the pathology within the extensor tendon, and the needle coming into the area of concern. In summary, platelet-rich plasma can be affected for numerous orthopedic conditions. The most common orthopedic conditions treated are lateral epicondylitis, Achilles tendonitis, patellar tendonitis, partial thickness rotator cuff tears, slap tears, and knee arthritis. This can be performed in the same visit with the use of a blood draw, centrifuge, ultrasound, and then injection. The total process takes approximately 20 to 25 minutes. PRP can be effective in reducing symptoms and enhancing recovery. There are very little risks and complications with this procedure. Further information can be found in video description from the American Academy of Orthopedic Surgery website. Thank you.